This is group assignment for COMP7750, Information and Knowledge Management. Our group name is Yun Hong Wai Group, and we have Yun Hong Wai and Mbek Kwai, that's me, and Fan Siu Long. And our topic is on UMP Healthcare Group with a Knowledge Management. UMP Healthcare Group is a healthcare service provider. They provide general and specialist health consultation, health assessment program including pre-employment examination and periodic physical check-up service, outpatient medical and health assessment, child health and development, laboratory and image processing such as X-ray, CT scan, etc., dental care and eye care, and optometry. We use knowledge management process on the UMP Healthcare Group, and we focus on using the discovery and detection, the knowledge management, and KM assessment. We do share KM sharing and how to reuse and recreate the knowledge and also the creation. And also we use the KM application for the knowledge management. KM discovery and detection. Actually, we have three types of knowledge. The first one, explicit knowledge, the existing healthcare documents and knowledge collected in a structural form such as medicine knowledge, patient health and medical record. Tacit knowledge, the knowledge comes from healthcare specialists, experts, or experience accumulation. The knowledge captured by the idea exchange. Use the questionnaires to identify what we have or don't have knowledge. Identify what should they need for healthcare service. Embedded knowledge, the explicit and tacit knowledge transformed to embedded workflow and procedure into healthcare service. On the KM assessments, we also have the quantitative. We need to understand of patient behavior and social network in healthcare sector. Evaluate patient experience, understanding of healthcare service. Describe complex phenomena include social, culture, and individual perception of healthcare service. And also what can enhance the understanding of the healthcare service and what can improve the patient experience. The interview and participate in observation with doctors, nurse, and patient to gather requirement of healthcare service. Inclusive analysis for healthcare workflow. KM assessment in qualitative. We seeking the explanation for the task, operation, and patient certification. Doing some research on conclusive for majority of populations. Answering the questions such as what, when, and where. Define measurable patient's health record and analyzing with statistical procedure in healthcare sector. Design what procedure and tools that can help to measure and capture what the needs in professional healthcare service to collect knowledge such as healthcare surveys and questionnaires. Control the variety of healthcare service environment as well. Deductive analysis for healthcare workflow and creating precise measurement formula and testing hypothesis to evaluate the outcome. KM sharing. In explicit knowledge, We need to creating documents, multimedia materials, identify different types of patient with classification, identify stakeholder in the UMP healthcare group, assign roles and responsibility to different group of people, use content management system to track and manage multiple versions of content, publish content to a repository to support different roles of use and access to knowledge information. KM sharing, tacit knowledge. We define the interaction of daily work in between doctors, nurse, and patient within the healthcare environment. We define a hierarchical network in UMP healthcare group for monitoring a daily operation such as clinic partners, healthcare service supplier, and patient social network. We define a dictionary to navigate the usage of knowledge sharing, provide information for supporting team, projects, community with sharing the information. KM sharing embedded knowledge. We're creating a set of scenario and hypotheses to support daily operation and healthcare access in UMP healthcare group. We review the daily operation process and investigate what and why the issue happened in daily operation, finding the solution to eliminate the issue. KM reuse and creation. Knowledge reuse and creation involve knowledge producer, intermediary, and consumer. For the producer, create fundamental knowledge and procedure package stored in knowledge base for sharing. Intermediary, knowledge intermediary is to develop relationship and network with producer and consumer of knowledge by providing knowledge linkage. Based on the knowledge relationship and network, it may discover another new knowledge in the healthcare operation. For the consumer, it's not just to use the knowledge. They also are knowledge producer because they accumulate the experience in use of knowledge and they may have feedback for knowledge enrichment. For KM application, we use clinic management system because CMS, clinic management system is a open source application for healthcare sector. It can manage clinic healthcare workflows such as patient appointment, patient health record, consultation, dispensary, and payment. This software used by Hong Kong Medical Association and most of clinics healthcare service in Hong Kong. Our teammate will introduce the following slide.
Thanks the previous groupmates. In my part, I will tell you about some annual to digital report. How is it applied to using in the medical system? In the huge of data, most of researcher and doctor would like to take the analysis and more case study. In the study, they can predict the precautions in the future and how is it to protect the citizens. Okay, let me take the example to you. There is some example in SARS at Hong Kong in 2003. Most of people got SARS diseases. Every patient is take the treatment in the hospital. When they arrived, they need to take the X-ray. This can show on the slide the picture on the plastic. If change the computer system, it will automatically take the image and store in the computer. It will show in the 1 and 0. 1 is stand for the get sick in the lung diseases, and the 0 is stand for the health color. It can easy to help the doctor to take the decision making on the treatment for the patients. Thank you.
The next is the clinic management system demonstration.